For most of human existence, illness was not understood. It arrived without explanation. It spread without mercy. It ended lives without apology. A fever was not a symptom. It was a sentence. An infection was not a diagnosis. It was a mystery. Pain had no cause. Recovery had no logic. Death had no pattern. And yet, humans watched. They noticed that some people survived what others did not. That certain wounds healed faster when washed. That some foods restored strength. That some environments brought sickness. They began to see repetition. And repetition is where knowledge begins. Observation became humanity's first medical instrument. Long before laboratories, there were eyes. Long before textbooks, there were memories. Long before data, there were stories. Across Africa, healers studied roots, barks, resins, and minerals, building complex pharmacological traditions that would later inspire modern drugs. Across Asia, systems emerged that examined balance, circulation, and diet. Across the Americas, civilizations developed advanced sanitation, surgical practices, and botanical medicine. Across the Middle East, some of the first hospitals were created. Across Europe, anatomical study and later experimental inquiry took hold. Different lands, different beliefs, different tools, one shared purpose: to understand what weakens the body and what restores it. For centuries, medicine lived between intuition and investigation. Some practices saved lives, some harmed them. Many did both, but even error carried information: which wounds rotted, which herbs healed. Knowledge was refined through survival. And slowly, healing shifted, from ritual to reasoning, from inheritance to inquiry, from myth to method. Then came one of the most important revolutions: the realization that disease was not invisible because it was unknowable. It was because we couldn't see. The invention of the microscope did not merely magnify vision, it shattered reality. For the first time, humanity saw a hidden world: cells dividing, bacteria spreading, viruses invading. Suddenly, illness had agents, processes, laws. Disease was no longer a curse. It was biology, and biology could be studied. Once disease had causes, it also had weaknesses. This moment transformed medicine from art into science. Vaccines emerged, preparing the immune system before exposure. Antibiotics followed, attacking bacteria with precision. Anesthesia allowed surgery to evolve from brutality into discipline. Antiseptics reduced infection, transforming hospitals into places of recovery. Healthcare changed in a single century more than it had in 10,000 years. Diseases that once erased entire cities were brought under control. Childbirth, once among the leading causes of death, became dramatically safer. Wounds that once guaranteed disability became treatable. Illness that once meant isolation became manageable. Life expectancy rose, not by years, by decades. Healthcare altered what it meant to exist. A child was no longer a fragile gamble. Adulthood was no longer rare. Old age was no longer extraordinary. Humanity gained something unprecedented: time. Time to learn, time to specialize, time to build institutions, time to transmit knowledge across generations. Healthcare did not just save individuals, it stabilized civilizations. When death retreated, planning advanced. Families invested in education instead of replacement. Communities invested in infrastructure instead of survival. Healthcare quietly expanded the human future. Modern economies did not rise on technology alone. They rose on longevity. Factories needed healthy workers. Schools needed consistent attendance. Healthcare became inseparable from national strength. Public sanitation prevented epidemics. Vaccination campaigns protected entire generations. Hospitals centralized expertise. Medical universities standardized knowledge. Health became measurable, predictable, manageable. And for a moment in history, it felt as though humanity had unlocked the code. Understand disease, control disease, eliminate disease. But progress revealed something else: complexity. As healthcare advanced, it also grew heavier, more specialized, more expansive. Hospitals became dense ecosystems of equipment and expertise. Doctors became narrow specialists. Treatments became advanced and costly. Healthcare grew more powerful and more fragile. It required stable funding, reliable logistics, skilled personnel, data systems. Medicine had evolved, but delivery had become the challenge. This is where divergence began. Some societies chose to build healthcare as a shared public foundation. Others allowed it to develop as a personal financial responsibility. Some invested heavily in prevention, others primarily in intervention. Some designed systems to reach everyone, others allowed access to follow income. The science spread globally, the systems did not. In some countries, healthcare became embedded into citizenship. In others, healthcare remained transactional. Treatment depended on affordability. Access depended on employment. Illness carried financial weight. The same medical knowledge existed across borders, but outcomes diverged. Where healthcare systems were well organized, populations grew healthier. Where healthcare struggled, preventable disease drained economies. The difference was not intelligence, it was structure. Healthcare does not fail because medicine is weak. It fails because systems are misaligned, because funding is unstable, because prevention is undervalued. Healthcare is not only about cures, it is about architecture, and architecture determines reach. Vaccines saved lives because cold chains reached villages. Antibiotics mattered because pharmacies existed. Surgery mattered because sterile facilities were built. Science without systems saves few. Systems without science save none. Modern healthcare exists at the intersection of both, but when systems grow too complex, they can drift from their purpose. Hospitals become overwhelmed. Clinicians become administrators. Patients become numbers. Forms replace faces. Metrics replace meaning. Processes replace presence. Healthcare, once rooted in human connection, can begin to feel mechanical. This is not failure of medicine. It is failure of design. The challenge of modern healthcare is whether we organize wisely, whether we build systems that strengthen communities, or systems that only manage collapse, whether we reward prevention or profit from intervention, whether we design for resilience or for reaction. Every healthcare system today reflects choices: what to fund, what to measure, who to prioritize. These choices shape outcomes. Healthcare is sustained by belief that care will be there when needed, belief that access will be fair. When trust collapses, even the most advanced medicine struggles. And this is where humanity stands now. With unprecedented medical power, the next era of healthcare will not be defined by what we discover. It will be defined by what we design, how we distribute what we already know, how we move care closer to people, how we realign systems with their original purpose. Medicine already changed humanity once, and it is about to do so again. The only question is whether our systems will evolve or be buried.